It's a shock for young people to be discriminated against just because they have an autoimmune disease.
This is not something we willingly wanted to have or did anything to get.
There are an estimated 280,000 people in Myanmar living with HIV or AIDS. Among them are many children who got the virus from their mother while in the womb. It was no fault of theirs, and HIV is not easily spread. But still, these children are having to contend with a world that treats them differently. Hello and welcome to Doh Athan, a weekly podcast about human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by a Doh Athan freelance journalist. Names and voices may have been changed to protect contributors.
This is not something we willingly wanted to have or did anything to get. It was like I had to come to terms with the fact that I have it without knowing anything. People say there is no discrimination, but in reality, there is still discrimination in everything.
Mawai is 24 years old. She was born with HIV or human immunodeficiency virus, which can lead to AIDS. Mawai lost her parents to AIDS when she was just a child. For most of her life, she has lived at a centre in Yangon, which takes care of children with HIV. She remembers being shunned by people when she was younger because of her HIV status. But once she got to the Nurture AIDS Centre, or NAC, she felt safe and cared for. She managed to get to university and has qualified as an accountant, but she still lives at the centre and helps to take care of the children there. Mawai says she's open with friends about her condition, and she can deal with whatever prejudice she faces. But she gets upset when the kids tell her about being treated meanly or unfairly. The children at the centre are like her family members.
The kids have told us, with tears in their eyes, that the mothers of some other children told them not to play with the kids from the centre because they had this disease.
HIV is not an easily transmissible virus. It's mostly spread through sexual intercourse or sharing needles or syringes. But discrimination can often happen if people don't know enough about it or how it spreads. And there's often stigma and moral judgment around HIV because high-risk groups include LGBTIQ people, drug users, and sex workers. HIV can also be passed on by pregnant women to their babies, like many of the residents at the NAC Centre. It accommodates 60 adults and over 90 children. Actually, about a third of the children don't have HIV, but the centre takes care of them because they're orphans. The children's main interaction with the outside world is at school, and sadly, even educated adults like teachers seem to be perpetuating the discrimination. Mawai says whenever children from the centre get sick or feel itchy, they're sent home immediately, and careless comments can also hurt.
They said their teacher told the other kids not to be friends with the children from the centre. They didn't show any resentment towards the teacher, but they looked rather sad. So I had to go and meet the teachers. I wonder if perhaps there was a lack of awareness about people living with HIV.
Doh Athan is a teacher who joined the civil disobedience movement. She said the education system is supposed to be more inclusive.
These children are also human beings, right? And they should be treated equally and be cared for. I believe educated people with degrees should have knowledge about the root cause of the disease and should treat the children with more compassion. They should be more careful of the consequences for these kids than for the others. These kids shouldn't be discriminated against or neglected.
Doh Athan is chairman of the Myanmar Anti-Narcotics Association and has worked for over 30 years in the fight against drugs and in helping people with HIV. He says this kind of discrimination should have ended long ago, and it can have a terrible long-term impact on children.
It's a shock for young people to be discriminated against just because they have an autoimmune disease. It's more scary for a child to grow up with the stress of this than actually having the disease itself. And this child will never be able to stand on his own feet in the world.
But to stand on their own feet as adults, these children will also have to keep battling against discrimination. Young people at the NAC have apparently faced challenges just getting new national registration cards or renewing them once they reach the age of 18. Without these identity cards, it's hard for anyone to make their way in Myanmar, to travel or apply for jobs. Mathusa is one of the people in charge of running the NAC. She said that even with the NRC cards, and despite past educational campaigns, there's still discrimination against people with HIV in the world of work.
Although there is training within organizations, it hasn't changed much in reality. Discrimination still exists in workplaces among employers. Even someone who sells betel nuts does not want to hire anyone with HIV. The acceptance rate is still very low when it comes to HIV in society.
Gomyo knows this very well. He's 25 and lives in Upper Myanmar. He got HIV 5 years ago, but he only told his mother and wife. He was afraid to tell others because of the potential discrimination he would face. He's taking antiretroviral medications, but otherwise he's able to work and live like everyone else.
I'm concerned about people finding out about my condition. I might get discriminated against when they find out, you know? They may say, this guy has the disease. Don't get involved with him. Don't hang out with him and so on. I have a friend. Almost everyone in the town knows that he has HIV and nobody wants to be friends with him. Whenever he applies for a job, people are reluctant and would say something like, they would contact him later and such. People don't include him a lot.
According to the Universal Declaration of Human Rights, specifically Articles 1 and 2, every human being is entitled to be treated with love and respect, to be given their inherent dignity and rights. But for the estimated 280,000 people living in Myanmar with HIV or AIDS, that respect and dignity is still lacking in many ways. Research led by Brown University in the US in 2016 among over 1,000 people with HIV suggested that almost 50% had experienced discrimination from society. Some of the worst incidents appear to be in the health system. Mathusa reshared the experience of someone with HIV who was upset when they were called by their name at a clinic instead of the token number usually used to protect privacy.
He mentioned that typically, NGOs use designated numbers that are on the books like 001, 002, but I don't know why the nurse or staff addressed me by my actual name. Does she not understand a basic human right?
Respondents in the 2016 survey also complained of this, as well as of being mistreated and even being refused medical treatment. Mawai said some private hospitals and clinics also charge double the price when patients with HIV need emergency surgery. Mawai has already experienced plenty of discrimination in her young life, but she takes heart from the donors and visitors who treat residents at the centre with respect and sympathy.
Some donors are really understanding and treat us very warmly. They are not scared and would visit the center to play with the children. There are also visitors who encourage us and give us motivation.
Mawai has a dream to become an auditor and is working towards that. But she's also happy to support and care for her siblings at the centre and encourage them in their own dreams.
I have the disease, but I am not discouraged because I am capable of so many things. I want to do what I can instead of being depressed about having the disease through caring for the children or supporting other people with HIV. I don't want them to feel discouraged.
Thanks for listening to this edition of Doh Athan. We would welcome your feedback on social media. This project on human rights reporting is supported by Fondation Hirondelle with the help of our donors. You can listen to our podcast via the Doh Athan Facebook page. They can also be found on SoundCloud, YouTube, iTunes and Spotify. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. Please tune in again next week.